hello and welcome, and to some, welcome back. If you will give me about 15 minutes, I'd like to share a video that we've entitled Coronavirus, Why Isn't That Being Reported? I think in a day when we're getting so much bad news, inundated it seems with that this will be encouraging to you if you'll take the time to watch it. Before I get too far down that road though, to those that were welcoming back, let me just say thank you for watching our first video entitled Coronavirus, Wait Just a Minute. Since the release, the first 72 hours, there were over 17,000 views and likes and reposts and comments, and thank you for those. It makes the project worthwhile if we've been able to move some away from that edge of panic, away from that edge of fear. But I hope you'll take that information and continue to do the analytics and follow the numbers. And as I continue to do that, it's more of an encouragement to me every day as I see those things. And that group that saw the first video that's come back, you're probably expecting this video to be about my thoughts and of why this is happening. I referenced that before, but I apologize. That will be the third and probably our last coronavirus related video. We're already working on that. It's entitled Coronavirus, What is Going On? But I needed to get this information out first because the conclusions that I've come to that I think are spot on are based largely upon the statistics and those types of things from the first video and the information in this video. So I needed to do these first. Anyhow, the video you're about to see gives factual information, not from alternative sources, not an alternative viewpoint. We're still using the same sources that the mainstream media uses and the president and the governors use, and those kinds of things from the WHO, World Health Organization, and the CDC, Center of Disease Control. And any other thing that we reference, we will actually put a link to at the end of this video, so you can go and verify everything. I want you to understand that the information comes from the exact same sources that you hear all the other information from. You don't have to make a choice of who you're going to listen to because it comes from the same source. And I think if you'll give us 15 minutes, you will be encouraged. It will be like a breath of fresh air to some who are smothering in this. It will bring clarity to some who have been muddled by all the things that are swirling around us. And I think it will encourage you, and we could use a little encouragement where coronavirus is concerned. So I hope you'll stay with us for the next about 15 minutes or so. 15 minutes. What could it hurt? Stay with us. Hey, thanks for staying with us, and we want to jump right in and hopefully give you some good news in the midst of all of the information swirling around the coronavirus pandemic. A couple of disclaimers first. When you push back against a mainstream narrative, often you're labeled as a conspiracy person who thinks it's a hoax and shouldn't be taken seriously and all of those types of things. I am not that guy. The coronavirus pandemic is real. People are getting sick. Many are dying. We need to have compassion. We need to be careful. We need to be prayerful for their families who are going through a very difficult time right now. I don't think there's some Illuminati type group that's trying to control the world through this virus or anything else. I am not that guy. Also, I want you to know if people say, that guy's wrong, I don't take that personally, because all that I'm sharing with you comes from the World Health Organization and the Center for Disease Control. If they say I'm wrong, they're saying those organizations are wrong. I'm not giving my opinions and my thoughts. That's for the next video, and probably my last, about coronavirus. But for now, the last video and this one is easily verifiable. It saddens me that someone would say, he was just wrong, and wouldn't go check and see. Because if they would go to the World Health Organization, specifically their dashboard or the Center for Disease Control websites, it would be encouraging to them to find out that the information is indeed correct. So I don't take it personally, just wanted you to know that. And let's jump right in. Let me give you 5 things briefly that really amount to good news that's not really being reported today like I wish it was. Number 1, according to the World Health Organization, April the 11th is a marker day, because on that day they reported 90,000 plus new cases of COVID-19. Here's why that's a marker. Because on the very next day, April the 12th, what we find there were 6,143 less new cases reported. That's significant because on the next day, the 13th, there were 7,361 less cases reported than the day before. That's significant because on the 14th, there were 5,703 cases reported, less than the previous day. That's significant because on the 15th, there were 1,843 less cases than the day before. Since they've been tracking this pandemic, never have there been more than 2 days in a row where the numbers dropped. But now we have we have 4 days in a row where the number of new cases went from 90,000 down to about 68,000 plus. Almost a third in 4 days. That's incredibly good news. Why isn't that being reported? Now, I know that the curve or the drop-off is not going to continue. It will go, there'll be bumps. I get that. It may be up today, it may be down today, but that's an incredibly good news story about this pandemic that I wish was widely reported because people would be encouraged by that, and they're not hearing it. Number 2, what I want to share with you is that the U.S. numbers, there was a spike of new cases, and there was a spike particularly in the death count that caused some alarming reporting and some anxiety. It's spreading wildly now and more than ever and all those kinds of things in the United States. But the CDC just put out recently a new directive. And we've linked it so you can see the directive itself, 6, 7, 8 pages, I forget now, that went out to all their doctors and hospitals. And in the new directive, they changed some things. And one of the things they changed is that now you can count them as part of the count of new cases if you presume, because of their symptoms, that they're positive. You don't have to have a laboratory positive confirmation to count them in that number. That's new. More troubling to me is that in that directive also, what you have is that the CDC is allowing doctors to put on death certificates, the cause of death being COVID-19, even if it's not been confirmed. Not a contributing factor. They're allowing you to put that as a cause of death. Now, there are starting to hear rumblings from some doctors, and some have put themselves out there publicly on local news channels and national channels, like a senator, I believe from Minnesota, who's also a medical doctor, Dr. Scott Jensen, and you know, he's a brave man. He might put his career in jeopardy by being so public about this, but he's been practicing for decades, and he was troubled by this directive because it's new. It's never been done before. And we've linked that video again to the end of this, so you can go look at it for yourself. But he went to his superiors, and his superiors said, you know, in death certificates, we've always been told to be specific. And so Dr. Jensen went back to the CDC's own manual about this very thing, and it talks about on death certificates, you need to be precise, and you need to be careful. And they're throwing all of that out of the water now, allowing you to put on a death certificate COVID-19 as a cause of death, even if it's not verified. How is that good news? Well, the spike in new cases, and particularly the spike in deaths, is directly correlated. If you chart the days and the number of deaths, and you compare that to the day this new directive came out, almost to the day, that's when the spike occurred. So the good news is there's not a crazy amount of new deaths because of this virus, but there's a direct correlation in the way those deaths that already occurred were reported. Why is no one saying that? That's incredibly good news. That the spike is directly correlated to the paperwork, not to an uptick, a large uptick in the deaths. We know the death toll continues to rise, but that spike is directly correlated to the change in the CDC procedures. I wish every person knew that, as opposed to being frightened by that spike. That's good news for me, and hopefully it's good news for you. Number 3. The third thing we want to talk about are the recovery rates. I'm going to spin out of here and spin right back because I want to go and get the exact numbers right now and come right back. Don't go away. Hey, I'm back with numbers hot off the press. The World Health Organization and the CDC numbers correlate very well, and this is what they tell us about recovery rates. With everyone included, with every underlying cause, if you get COVID-19, you have a 95 to 96% chance of full recovery. The mortality rate is somewhere between 4 and 5%, no matter what your underlying causes are. That is fantastic news. If you're a healthy person with no underlying health issues and you get COVID-19, you have a 99% plus chance of full recovery. That is great news. Why is that not being reported? There are many who are asymptomatic and get COVID-19 or sick for a few days, and it goes away never even knowing that they had it. If those people could somehow be included in a statistical analysis, and there's no way to do that, but if they could, those numbers would only get better, which puts the COVID-19 numbers very close to, for healthy people at least, very close to, in every category, the numbers of the flu. That is great news. If there are people on the wrong side of those statistics, that's tragic. They are not to be ignored. We should have compassion and care about that. But for the rest and the normal population, we're told that if you get COVID-19, it's almost like a death sentence. It's dire. Well, no matter what your underlying causes are, the truth of the matter is you have a 95 to 96% chance of recovery. If you're healthy, you have a 99% plus chance of full recovery. Why is that not being reported widely? It's such good news. The fourth thing that I want to mention briefly has to do with the surge. We've been hearing about the surge for weeks, and things have been canceled to make room for the surge. Equipment has been saved because of the surge. Well, now the CDC and the World Health Organization and even our president acknowledged we're probably at the apex or even a couple of days past the apex. And the good news is that we have not been overwhelmed by, capacity-wise. We have not been overwhelmed population-wise. I don't want to ignore particular hotspots like New York City. That situation is very different. In New Orleans, that situation is very different. But as a country, the good news is that we are not going to be overwhelmed, that we haven't been overwhelmed. That's fantastic. In Seattle, where a lot of the first numbers that frightened us so much came, the U.S. Army set up a field hospital to wait for the surge to come. Well, that hospital's already been dismantled, and they left Washington State having not treated one patient. I'm not questioning their preparation, but it's good news that they were not needed. The United States military sent the hospital ship Mercy to L.A. and the hospital ship Comfort to New York Harbor to be a help. I'm thankful for that. But as of the 14th, the Mercy in LA had treated 20 patients. As of the 14th, the Comfort in New York Harbor has treated 120 patients, and 50 of those have already left. The capacity is so not needed that now the Comfort is actually taking patients from the Philadelphia area as well. In the vast part of the United States, we are not overwhelmed. The system is not overwhelmed. Our population is not overwhelmed. That is fantastic news. And you're starting to see more reporting of that now in many different outlets. And the president start talking about reopening our country, and governors are making plans, and all because of these very numbers. That's great news, and we should be reporting them more and more. Lastly, as of today, if you compare the coronavirus with other serious viruses in recent history, you would be encouraged. I have multiple times compared, just as a baseline, the outbreak and the deaths to the flu. As of today, there are 32,000-ish deaths from coronavirus. That's between 1/4 and 1/2 as many of those that died from the flu in 2018. That is good news. If you compare coronavirus to N1H1, the swine flu, in our country we have over 630,000 cases confirmed and supposed of coronavirus. N1H1, the swine flu, over 60 million Americans were infected with that. That's good news for us today. If you go outside and even compare things like the HIV virus, in the numbers of 2018, there were 1.7 million new cases of that. In 2018, over 770,000 related deaths. All of those things are tragic. The 32,000 plus for coronavirus is tragic. But as you relate this serious virus to other serious viruses, it's good news for us that we're not near those numbers. I hope that you're already breathing a little easier. I hope that you go, that is good news. Why is that not being reported? Why are we not being told these things? I hope you're already thinking that way. And I'm going to go and be back in a minute for some closing thoughts. I hope you'll stay with us. I'd like to leave you with several basic thoughts, if I could. First of all, as you hear news reports or watch news conferences about new cases and deaths from COVID-19, and it's sad, it's troubling. But I hope now you also have the thought, the good news is that those numbers have started to come down, that we've reached the apex, and maybe it was a few days ago, but there's significant evidence that those numbers are starting to come down. It's encouraging to me. I wonder why they don't add that to the story. Secondly, as you hear of new hotspots and trouble areas, and you will, that's the way it is with every virus. I hope that now your next thought is going to be, whether it's a hotspot where I live or somebody else lives, the good news is that 95 to 96% of people will recover. If they're healthy, over 99% of people will recover. The deaths are tragic, but just to get COVID-19 is not a death sentence. I wish they would add that to the equation and to the story as well. It would help so many people. I wonder why. That is not reported as well. And then thirdly, as people talk about how bad things are and how contagious and how high the numbers are getting, I hope in your own mind that you can think, yeah, it is bad, and we need to be careful. But as I compare it to other serious viruses in our culture in recent memory, it's not as bad as the swine flu N1H1. It's not even close. It's not near even things like HIV. It's not even close. Even as I compare it to the flu right now, it's not killed even half as many as the flu killed a couple of years ago. It's serious, but that's good news for us. I wonder why they don't include that in the report. It would be so helpful to people. And you may say, well, if the facts are what you say they are, why are they not telling us? Again, it may sound redundant to some of you. I have answers for that. I have answers that I think are very spot on, but I don't want to put them here in this video, because if people don't agree with my ideas, then they'll have a tendency also to not latch onto the facts that I presented here. And that's all I wanted you to have, is hope, encouragement. Here's some good news in the midst of all of the other news that we're constantly being bombarded with. So I hope you're encouraged. I hope that you examine those statistics and be safe, be careful. By the grace of God, we'll get through this. I hope you have a great day.